would check my order and I would see that I would be inserting an IV. I would go to my patient's room, I would knock. Once I entered the room, I would greet my patient. I would tell them who I am, what the procedure is that we're about to do today. I would make sure that I made sure that their wrist bracelet and that their name matched what they said and what was on the bracelet. Once that was taken care of, I would make sure that they didn't have any allergies to iodine or any kind of latex allergies or anything that would be causing me a problem today. Once I did that, I would make sure that they were okay with the IV insertion. Once they were, I would make sure that all my supplies were over here. I would wash my hands. Privacy would be provided for. I would then raise my bed. Once I got to the bed to a good body mechanics and I was ready to check for placement, I would then have my patient give me their arm. I would apply my tourniquet. No, I wouldn't. Before I applied my tourniquet, I would take the syringe and I would flush it through the tubing to make sure that the tubing wasn't damaged and that it was okay to be used. Once that was done, then I would apply my tourniquet. Maybe. Once it has been applied, we'd check for vein. If there was no vein there, I would move on down to the hand. Let's see. Okay, once I found my placement, I would then come over and get my saline or my iodine or my alcohol swab, whatever I was using. I would clean my spot. I would put on my gloves. My gloves would have been on the table. So the site was already clean, but since it took me a minute to get my gloves on, I would reclean my site. I would do it in a circular motion, inward out. Once my site was clean and I was ready to insert my IV, I would reapply my tourniquet. The quick release. Once my tourniquet was applied, I would then make sure that my vein was still where it was when I chose it to begin with. I would insert my IV. Once my IV was in and I had blood return, I would remove the tourniquet, make sure that the catheter was advanced as far as it needed to be. I would then remove the needle, drop it into the sharps container. I would put the adhesive on to make sure that it didn't move in place. Once it was ready and the patient was comfortable, I would then take the tubing, make sure that the tubing was either hooked to an IV pump, make sure it was hung in the pole, make sure that the right medication was being administered or saline, whatever they had ordered. I would then put my patient back down to the lowest position, assure all 4 side rails were lowered. I would give my patient their call light, and I would remove my gloves, wash my hands, bye-bye for privacy.